And so this month's presenters are Age Well, and we have Tracy and Aaron are going to be doing a presentation on their services and supports.
Excellent. Thank you, Eric and Melinda and everybody. It's nice to see everyone. And I want to just start by saying I know there are so many organizations here doing such meaningful work in our community. And we certainly love to collaborate at Age Well with other organizations. And so I'm thinking, as we go along, if you want any more information about something specifically that Aaron and I talked about, I know Melinda and Joe, and probably most of you have my email, so feel free to reach out. We love to also share community information. Age Well has a pretty robust social media and communications plan. And so if you have programs or events that you believe would benefit older Vermonters, please make sure you share those with me, and I will be happy to get those promoted one way or another. And we can talk about the best strategy for your particular program. I'm going to share my screen, hoping that you can see this particular presentation. I can't see you anymore, so can someone tell me if they can see this?
Yeah, we can see it.
Looks
Excellent.
good.
Excellent. Okay, good. So I'm Tracy Schamberger, and I am the Director of Business Development and Communications at Age Well. I'm joined by my colleague, Erin, who introduced herself, Erin Rolke, who is the Director of Care and Service. And we're going to walk you through some of the programs and services that we think specifically would resonate with you as you're doing your work in the community. You may think of Age Well when you think of Meals on Wheels, but there are many more services that we offer to older Vermonters, and we just want to make sure we highlight those for you. And then we'll allow some time for questions at the end. So I will get started here. Okay. So here we are. Our mission at Age Well is really to provide the support and guidance that inspires our community to embrace aging with confidence. For a little background on who we are a designated area agency on aging, designated in 1974. We coordinate care and service for Addison, Chittenden, Franklin, and Grand Isle. And really our goal is to keep folks at home, supported with our services so that older Vermonters can remain at home where we believe they want to be, or in a setting of choice. We are a nonprofit and we have many partnerships, many of which are here. United Way, I can think of right off the bat, but you can see this is just a sampling of some of the types of organizations that Age Well intersects with on a regular basis. So homeless prevention, transportation providers, any organization that really focuses on food insecurity, social isolation. And then of course, we collaborate very closely with home health and designated mental health. As I mentioned, organizations that serve food and many other organizations. And we'll be talking a little bit about that as we move on. The other thing is we have programs where we work specifically with organizations like Falls Free Vermont. We will be going over all of these different services, our helpline, our care and service clients, Meals on Wheels, but this is just a sampling from the last year of some of the impact. You can see, as you can imagine, Meals on Wheels did take a significant uptick in meals served, primarily due to COVID, where we saw anywhere from a 26 to a 40% increase. So we are over 300,000 meals this year compared to last year, which was significantly less. I'm going to let Erin talk a bit about our helpline, which is a wonderful resource for all of you to know and to promote if you are having any clients or yourself or family members or caregivers that you know that may benefit from calling the helpline. So I'll let Erin go over a little bit more about the helpline.
Thanks, Tracy. So I think it always makes sense that we start by talking about the helpline because it's really the main point of access for any of the services that we're going to go over today. We've got 4 information assistance counselors who work on our helpline. It's a very active helpline. It's available Monday through Friday, 8:30 to 4:30 during our business hours, and then we return any voicemails that come in after hours the next day. But it is really, as I said, the way to make referrals to any of our services, but they do much more than that. I would say internal referrals are a pretty small part of what the helpline does. Their purpose is really to connect clients, caregivers, community partners to resources that are available to older adults and their caregivers. So we make internal referrals, as I said, but a lot of the work that we do is making external referrals, often to many of the agencies that I know are represented here. So if someone is calling and looking for resources that are available to them in the communities that we serve, we'll help connect them to some of your agencies or to other resources that are available in the community. They also provide a lot of information. So someone can call our helpline if they're looking for some, basic asking questions about applications. How do I fill this out? Where can I get more information about this kind of thing? We really field all kinds of questions. It can be as simple as, is there a program that can help connect me with food assistance? And we'll provide some information about 3 squares. It can be, the well is broken and I don't know where to start with that. Can you help me find resources to get that fixed in my area? So really a wide range of calls we get on the helpline. And then one of the types of calls we often receive are related to Medicare. So we have a state health insurance program here with 2 state health insurance counselors, or we call them SHIP counselors. They are really our Medicare experts. They help clients who are starting on Medicare for the first time. They also help to navigate, picking the right prescription drug plan, for example. So, we always recommend that people review that every year during open enrollment or when they're eligible to make sure that all of their medications are covered. The SHIP counselors also help navigate access to care issues. So, a medication or procedure isn't seeming to be covered by insurance and there's, difficulty for the individual to access that, they can call our state health insurance program and help to get some assistance with that. SHIP is a little different than some of our other programs. It doesn't have an age criteria. So most of our programs are 60 plus, but really the only criteria for SHIP is that someone is calling with a question about Medicare or they're on Medicare and calling with some related insurance questions. And then there are a couple of services that I'll talk about next, both this slide and the next one, that are really a little bit more assistance than is provided at the helpline. So these are 2 services, options counseling, and then the next slide will be community health work that can go out and meet with clients in their homes and help to navigate some resource questions. So options counseling, this first one, really does a couple of things. We can help clients with access to resources that they may need right now. So I talked about the well issue. If someone calls our helpline and just says, hey, I really just need a list of contractors in the area, that's great. We can provide that at the helpline. Let's say it's someone else who's calling and saying, I need financial assistance to pay for the well repairs. I need help navigating that process. I don't even know where to start. I'm not even sure if, there are other programs that I can qualify for that'll help relieve this financial strain. And, maybe I have a visual impairment and I'm going to have trouble with the paperwork, or for whatever reason, I would like more assistance with that process. I've never done it before. An options counselor can go in and meet someone in their home and provide hands-on assistance with all of that. So really all of our services, we try to meet people where they are. So provide the level of assistance that they're really needing help with. And the other thing that options counseling does is long-term care planning. So we often get calls from people who don't have any resource needs now. They may not need any care assistance or help accessing resources, but they want to plan for the future. So, you know, as Tracy mentioned, a lot of our programs are really geared towards helping people to stay at home. And we really encourage people to plan for the future. And so they may not need anything in order to do that today, but thinking, you know, 5-10 years down the line, really wanting to understand what options are available to them, what planning they may need to do. If there's financial planning that needs to happen between now and then, our options counselors can really help to guide that process. And then I started talking a little bit about community health work, similar to options counseling in that it's a short-term service and can go out and meet with clients in their homes. Usually when I say short-term, it's usually 1 or 2 or 3 visits, depending on what the person needs. It's really based on, you know, what assistance they're requesting. And community health workers are really focused on helping connect people to public benefits like 3 squares, fuel assistance, other things that can help them meet their monthly living expenses. They also do falls risk assessments to help improve home safety and reduce falls risk. And they do home meds assessments as well, which is a really great program where both the community health workers and we have a care and service coordination RN who do this work and go out and meet with clients in their home and review the medications that they have on hand to see if there's any potential, you know, medication errors, meaning there's, you know, medications prescribed by 2 different doctors that may interact with each other. We don't see that very often. What we see more often is, you know, clients who might be taking a medication in the morning that causes dizziness, and all of the medications, once they're collected by the staff person here, are sent to a pharmacist to review that med list. They'll come back with medication with recommendations. So they may say, hey, we noticed that you've had falls recently and you're experiencing dizziness. This medication that you take in the morning might cause dizziness. We would recommend you talk to your doctor about maybe taking that at night instead of in the morning to reduce your risk of falls. We also help to remove, you know, expired medications from the home to help reduce, you know, possible other mal effects from taking those medications. And then we've got care and service coordination, also called case management. I think many of our clients know us as case managers, so you might hear that term more frequently. But this is really the long-term care and service coordination that happens with clients. So our care and service coordinators will often work with clients, you know, seeing them monthly and having phone calls in between for very long periods of time. So it might be 6 months, it may be many years. Many of our clients who are receiving care and service coordination are on a long-term care program like Choices for Care or the Moderate Needs program, where they're getting some services in their home to help support them with living independently. The care and service coordinator or case manager helps to coordinate those, and they also might help to you know, resolve other issues that come up. So I brought up the well issue because we're in Vermont, but you know, if a care and service coordination client has that obviously presents a pretty immediate barrier that is makes it a challenge to live at home. So we want to help people to resolve those. So coordinating the services and then also helping to really tackle some of the social determinants of health as well. And then self-neglect, I think, is always really important to talk about. So Vermont is very unique in that it's the only state in the US where self-neglect referrals go to the area agencies on aging for individuals who are over 60 and not to Adult Protective Services. In every other state in the US, it's Adult Protective Services. So we like to be different in Vermont, and that's that's one way. So the way that the state of Vermont defines self-neglect is really someone who is unable to meet their basic needs or take care of their personal safety. And it needs to be the result of some challenge in decision making that could be related to a medical need. So it could be someone who has a diagnosis of dementia, for example. It could be someone who has a temporary challenge with decision making or taking care of those basic needs because of a urinary tract infection or acute medical issue. And so often we get these referrals because someone is, you know, potentially living alone, and maybe neighbors or family or our community partners have noticed that there's been a decline in, maybe personal hygiene, could be open wounds, could be a decline in the physical environment. And there's often we're getting the referral when there's some pretty significant safety challenges or safety issues. And so when we get a referral for self-neglect, those go to our specialized care and service coordination team, who will reach out to the client really quickly. Often it's always within 48 hours, but often it's even sooner than that, same day, especially if it's a really acute issue. And what they will do is they'll go out and determine whether or not the client does meet the definition of self-neglect. And under the state of Vermont, I would say that's the less important part. The more important part is really to start building that relationship with a client. Often we see self-neglecting clients or potentially self-neglected clients are resistant to services or may have a poor experience in their history with services or community providers or the state. And so we're trying to build up that relationship to help to rebuild some of those connections and support people with their needs. Even with clients who might have impaired decision-making, we're still very person-centered. So we're not going in and trying to, remove people from their homes. It's really trying to understand where the client is and what their goals are and how we can help to support a more safe situation. And then caregiver support. So unlike most of the services that I've talked about, which are really focused on the older adult themselves, our caregiver support program is really specifically designed to support family and friend caregivers of older adults. So we know there are many family caregivers in Vermont, and with shortages in paid caregivers, even more often stress is placed on them. So our caregiver support team can help to do some evidence-based assessments to assess the level of stress and burnout that the caregiver might be experiencing, and then help connect them to some services. So it could be respite services to give them a break. It can be dementia education to help them build some tools to really ease some of the burden of caregiving and give them some peace of mind as well. We offer some evidence-based workshops, and then also help connect people to peer support. And all of those can be help to support the caregiver in the work that they're doing. And I think, Tracy, the next one, I'll hand it back over to you to talk a little bit about Meals on Wheels.
Yeah, sure. Thanks, Erin, for all that great information. So as I mentioned, in my introduction, many of you may know Age Well and Meals on Wheels, and we run the Meals on Wheels program in Addison, Chittenden, Franklin, and Grand Isle counties. We're the largest provider of Meals on Wheels in the state, and we offer meals really to help people manage their chronic health conditions. We want to make sure that people not only receive a delicious, nutritious meal, but also one that is tailored to their own personal health needs. So, for instance, if someone has diabetes or is pre-diabetic, we certainly don't want to offer them a meal that we want to make sure that we're wrapping around services so that they are receiving the proper meal. So we have 8 medically tailored meal options. Heart healthy, diabetic, lactose-free, gluten-free, lacto-ovo, mechanical soft, and soft. And every single day of the week, Monday through Friday, approximately 600 of our volunteers meet at our hubs, our 24 hubs across our county, our service areas, and they deliver over 70 meal routes every single day. And I always love to say that Meals on Wheels is more than just a meal, because I think the real magic happens when the volunteer shows up and they greet the client. And I've been on many Meals on Wheels routes, and I will tell you that there is something really incredible about that experience. And I think it's just the person who's receiving the meal knows that there's somebody there every single day to check on them. And that's a really, really important piece of what we do, particularly around safety and also social isolation. So really Meals on Wheels is a program that's tailored for people who are homebound. They may have trouble preparing their own food. They may have just returned home from hospital or rehab and they can't prepare their own food. So it may be something that's short term, it may be something that's long term. So it depends on the client's needs. We also have a variety of other programs to encourage people to get together. We have community meals and events, which is not Meals on Wheels. It's typically other people in the community who want to get out, socialize, have a healthy meal. And we also have grab and go meals, which are now offered at locations across the state for people to come and pick up a meal. And what we've noticed there is that not only are they coming to pick up their meal, but they're meeting with their friends and they're gathering. So really driving people getting together and preventing social isolation. And you can see here, the respondents from our survey this past year really shows that 95% of folks who are at home say that Meals on Wheels is a program that enables them to remain at home. And my favorite little statistic is that 1 year of Meals on Wheels to provide to a client is equivalent to about the same cost as 1 day in a hospital or 10 days in a nursing home. And I think that's pretty profound if you think about the average cost of a meal being $11 a day per person, is just astounding to me, that, you know, the impact of that service. Our volunteer program, I just want to hit on because I know Joe has been really great in helping us spread the word when we need new volunteers, and we're always looking for volunteers. Our volunteer program is the largest volunteer program in the state of Vermont with over 1,200 volunteers. As I mentioned, about 600 of those volunteers serve Meals on Wheels, but our other volunteers do things with our clients, such as, you know, they may go grocery shopping, they may just provide some assistance with transportation to appointments, maybe to a physician, or just doing errands. They may provide some assistance with budgeting, or they may just go and visit with the client and go for a walk and play with their dog. I hear really incredible volunteer stories, both from clients and from volunteers. And I can tell you that volunteers say that the experience for them is just as rewarding as I hear it is from our clients about receiving the service. So with that, I will open this up for questions. I know we provided a lot of information, and I'm hoping that the information that we provided today, you know, you had some moments where you said, I had no idea that AgeWell provided this service or that service. I'm going to stop sharing so I can see you. And there we go. So I think I'm back in the meeting. Did I stop sharing?
No, it looks like you closed your presentation, but you want to go right to the bottom to the share screen area and click on stop share, or it might be in the upper right-hand corner of the toolbar. It should be red and say stop share.
Yeah, I see it. It's just not stopping.
See if I can bounce us back. Oh, here we go. I think I can do it. Okay, I got it.
Oh, you're amazing. Thank you so much. Thank you very much.
Absolutely.
So I know that many of you probably in some way or another, we collaborate with many of your organizations, United Way. I know Home and Health and lots of folks here that we collaborate with. And I'm hoping that based on what you heard today, you feel that perhaps there's a way for us to better engage and collaborate together. I know that, particularly during COVID, this group, and I know this group historically, there's so much information sharing. And as I mentioned, when we first started, I love to know about what everybody else is doing so that we can share the great work that you're doing and the resources that you are offering to those that we serve. The one thing that I didn't mention and is really, really important is that AgeWell does not charge for our services. So very often when we go into these presentations, I know people hear all of this wonderful, this is available and that's available, and what does it cost? And the answer is we are federally, state, and locally funded. So we do not charge our clients for services that we provide. And that's an important piece. So I'm hoping that there's some questions.
Yeah, hi, this is John Gorton, and yeah, we do the grab and go distribution once a week from our food shelf, and we've been doing that for quite a bit now, Tracy, and it's worked out really well for us. It's interesting. When we first started, within a couple of weeks, we jumped right up to about 75 families, 75 people. We've kind of backed down now to more like about 55 or so, because it's several people who kind of stopped, but some of those people are coming back, have re-signed up just within the last week or two. And I'm kind of suspicious that as we get closer to fall, people, we're going to see an uptick again. More people who kind of gave up on the meals or, haven't needed the meals through the summer are going to start wanting them again. And I'm hoping that we do have the building set up now where we can do in person. So at some point, I want to talk with you folks about maybe having a sit down dinner instead of just doing grab and go.
But we'd love that. That would be fabulous.
I wanted to make sure I understood, so that like the option counseling and the community health network work that you do, both of those are done in person in the people's homes, right? A counselor, the person goes to the person's home, and those are relatively short term. You're expecting those to be, okay, I may go 3, 4, 5 times, and then I've kind of done, you've done everything that you can do for that person. You got them connected to the other services or whatever they need, and that's the end of the show. Whereas the care stuff, the in-home care stuff, that's long term. That's long term, where you're going to somebody, you'll be going to somebody's house, say once a week until they die, right? Is that correct?
Yeah. So, and the options counseling community health work can certainly lead to care and service coordination. So, if they get past those, 1, 2, 3 visits, and there's obviously, more need, and the client would like us to continue working with them on some active issues, they can make a referral right to the care and service coordinators to continue that work. And often on the other end of that, when we close someone for one of those short-term episodes for, say, options counseling or community health work, that conversation is not, okay, well, good luck with the rest of your life. Part of our decision in with the client to say, okay, I think we've completed this work together that we took on for this short-term episode, is making sure that they know how to call our helpline back if they need assistance. So we have clients who may be, short-term, so to speak, with community health work, but they may call that community health worker, every 6 months. So it could be just when the benefit applications come in, and then when the renewal comes, they're going to call us back with questions that come up, and that might be even just over the phone. They're working with the same person they worked with before to say, okay, remember we did this last time, and here's the same application, so send in these verifications. So we can really provide, just as I said, just the support that person needs, and we also can do it virtually. So we do have clients where it's an older adult and a family member who's out of state, and they want to have a virtual meeting by Zoom instead of a home visit. We can do all that kind of thing as well.
All right, super, thank you. And thank you for your work.
Yeah, thank you.
And thank you for such great, I just really appreciate this group, because very often, as I mentioned, I will send something out to Joe or Melinda, and particularly around our vaccine We had a huge vaccine campaign and I shared the information, and I think within like 2 days, we definitely saw an uptick in calls and inquiries about older Vermonters getting vaccinated, either at home or helping them with transportation or translation. And that's another thing we should mention too, is that, you know, we do have a team, a dedicated New American team that does a lot of really great work in the community. And, you know, we're always looking for particularly information that we can share with diverse communities. So if you have information and you have it translated and we can share that, we are happy to do that. We work with lots of diverse organizations that are serving a whole variety of individuals, and I think particularly reaching rural folks is a challenge, I'm sure, for not just Age Well, but you know, we are really working as many of our community partnerships as we possibly can to spread the word. So I appreciate your sharing the information when I send it out. And as I mentioned, I'm happy to do the same. So I think, Eric, that wraps it up for us if folks don't have other questions. And I just put my email in the chat. So if anybody wants to reach out, please feel free.
Fantastic.
Hi,
Oh.
this is Denise. Can I just ask a question? What's the, like, I guess, is it families that tend to reach out, or is it actually the individuals that might need help, or is it kind of a combination of both? And then how do you include the families and the services that you're providing? Yeah, I guess that's my big question, is how the families interact with you versus either the individual. I'm assuming it's dependent on the structure, but.
Yeah, it's all of the above, for sure, Denise. We receive clients who self-refer for any of our services. We have definitely a lot of caregivers and family members who call the helpline to refer clients for services. We have community partners, which could be someone who is working with a client long-term, or it could be someone, you know, a community partner who briefly interacted with a client. We receive referrals from EMS providers, for instance, who went to the home to respond to a call, and maybe there, you know, wasn't a medical need to transport the client, but there were some other issues that they observed, and they would like someone to check in. So our referrals come from all over the place. And then in terms of including family members in the process, it often, as you said, depends on, you know, what that family structure is. So because we try to support both caregivers and older adults, there are times when, you know, the older adult really wants the family members to be involved in the whole process. There are times when the older adult would like the family member to really be the point person who we're communicating with. I would say that's less often. Most often we're communicating directly with the client. So we often have, you know, meetings with family members and clients. We also have situations where the client's goal and the family member's goal might be at odds with each other. So that certainly comes up. I think we probably all serve families like that. And there are times when we have an opportunity to support maybe the client through care and service coordination and the caregiver through caregiver support, especially when there's a lot of stress in that situation because the goals are in conflict with each other. The caregiver would really like to see a different outcome than the client, you know, very strongly wants for themselves. And so we try to meet the needs of sort of the whole support network there, and shifting between the two if we need to, between caregiver support and care and service coordination. We also provide, you know, just a lot of caregiver support, not just through our caregiver support program, but also through the helpline and options counseling and community health work. So we know that caregivers take on often more than just the, you know, emotional and the physical care. There's often financial stress on caregivers who might be paying for, you know, items that are needed for the older adults. And so, you know, helping to support with connecting everyone to the programs that they're eligible for can help to sort of support the whole system of the family member and the older adult. So Denise, I hope that answered your question. It definitely depends on the situation for sure.
Yes, thank you very much. I appreciate that.
And I would just add one thing about caregiver support, and that is that we also have volunteers who will relieve caregivers. And I mean, they will quite literally provide some support so that the caregiver can go do something that they may want to do, even if it's just for a little bit of time, just to get a break. And so our volunteer programs also support caregivers. I don't think there are any other questions, but certainly reach out anytime to us. And also Joe Halco and Melinda have this presentation if you're interested in the PowerPoint. I think you have it, right, Melinda?
Whoops, sorry, I was muted. Yes, I do.
Okay, excellent. Thank you very much. If you're welcome to send it out if you'd like.
Perfect. I'll attach it to weekly updates this week.
Thank you very much.
That was going to be my next question, if you could share the PowerPoint out with us, but sounds like you've already got that under control, so great. Any other questions, or are we ready to move on to the next item? All righty, so next we have, anybody have any new initiatives or upcoming events that they would like to share out with the group, make us aware of?
Yeah, I like to make sure everybody knows, not this Saturday, but next Saturday, the 16th of July is Old Home Day here in Sheldon. There's a parade that starts at 11 o'clock. The Historical Society Museum is going to be open from 9 to 11 for, kind of open house. And then the parade ends up by that big field that's up by the cemetery. And there's a barbecue at noon and live music and a whole bunch of entertaining events. There's be some antique tractors and antique cars, and there's going to be a guy there doing chainsaw carving. So chainsaw carving demonstration and a whole bunch of stuff. So come on out. Hopefully it's going to be a good weather day, and come on out and have fun. Keep me in mind. I am the master of ceremonies, so I get to control the show.
Very good. Anybody else have anything they want to share?
Vanessa with Pyre again. I shared in the beginning of the meeting, but I think a lot of folks weren't on yet. I put some information in the chat about a survey that I am working on. So I won't go into too much detail here, but basically we're looking for participants. It's an anonymous survey. Participants will get $25 gift card for participating. It's over the phone. The eligibility, since it's regarding new buprenorphine legislation, is for individuals to have either used heroin or opioids in the past 3 months, or to be on medication-assisted treatment. And I would love help getting the word out, both for the phone survey, as well as if there's events or locations where I might be able to come to do some surveys on the spot. That allows for the participants to get the gift cards more immediately, and just allows us to kind of reach some folks that we maybe otherwise wouldn't be able to reach. So my contact information is all there, and I appreciate any ideas or support you can offer. Thank you.
Very good. Thank you, Vanessa. Anybody else have anything? I will go then. So as I was saying earlier, tomorrow at 6 p.m. Vermont Adult Learning is having its graduation. It's going to be in the Bliss Room above the St. Albans Historical Society and Museum. Anyone is welcome to come and attend. It is also going to be live streamed on the Northwest Access YouTube page, and I'm just going to drop a link in the notes here to the Facebook event page. So if anyone's interested, you can get the details there. Thank you. Ben, you popped up. Did you have something you wanted to add?
Yeah, just real quickly, a week from today at 11 o'clock a.m. right here at Tim's house, we're going to be hosting a press conference just to talk about our partnership with CVOEO becoming one of those programs. So we'll be speaking for a little bit around 11 a.m. And then in the lobby of Samaritan House, we'll have some artist renderings of the plans for our construction here. For those who don't know, we are renovating beginning this fall to move from a congregate shelter to single room occupancy. So that's going to be a pretty big undertaking, but one that we're excited about. So if you're able, come join us a week from today, beginning at 11 a.m. Right here at Tim's house. Thanks.
And when you do that renovation, how's that going to affect like your client base while you're doing the renovation?
Yeah, our hope is to not displace anybody. What we're going to do is one floor at a time. For those of you who haven't been here before, we're 3 stories here. The first floor is where I'm sitting right now. It's office space. And then the second and third floor is our shelter. So what we'll do is empty out the third floor at first. So as people move out of the third floor right now, those beds probably won't be refilled, or at least not filled to capacity. So we'll begin construction on the third floor. Once those single rooms are ready, any guests on the second floor will move up. So we're hoping to do this over the course of quite a few months. It'll take a little longer to do the construction because we don't want to displace anyone, but that's certainly the way that we want to approach. So our hope is that no guests will have to relocate because of this renovation.
Very good. Thank you, Ben. Anybody else have anything that they want to share or add? All righty. Well, I guess we are done in record time this week. Thank you, everybody. And let's see here. Let me just look ahead. What is next month's meeting? Looks like it is going to be August 3rd. So 9 o'clock on August 3rd, if you want to show up at 8:30 and socialize with everybody, that is fantastic as well. Otherwise, everybody, thank you for coming this week. Thank you, Tracy and Aaron, and we will see you next month.
Thank you for having us. We appreciate it.
Thank you, everyone.
Thank you.